Hello there, and thanks for joining us this morning on Daybreak Africa. Well, we're here again, and as you already know, that it's a healthy day on Daybreak Africa where we talk about issues and topics that revolves around health. And one of the major things that not major, I would rather put it minor, that a lot of Nigerians and people, especially in Africa, do not pay much attention to is physiotherapy. And people do not often look at that part of health. They focus majorly on medicine and many other parts of health to see that they get the health goals that they desire, or they get cured from a particular ailment or disease. People often go for physiotherapy when doctors recommend it, or maybe doctors advise them to. But hardly would you find people or persons in Nigeria or in Africa voluntarily seeking the advice of a physiotherapist. Now, this morning we have looked it up and we have decided that, okay, let's talk about this. And to talk to us about this is a physiotherapist himself. We have with us this morning Tamilore Olukoya. Good morning, Mr. Tamilore.
Good morning.
Good to have you on the program.
Thank you.
Thank you so much for joining us. Now, let's go straight into the topic. And in my introduction, I am sure you've heard what I said, which is about people not really paying more attention or so much attention to physiotherapy. However, there are a lot of myths and legends about physiotherapy. There are a lot of misconceptions that people have. So I want you to clarify for us. Firstly, what is physiotherapy?
Okay, thank you. Thank you for the privilege. I really appreciate. Okay, the first thing is, if I'm going to summarize physiotherapy in one word, I will summarize it to be movement. Like, and what do I mean by movement? It's a word that is actually all-encompassing. The movement of the toes, the joint of the muscle, because our body comprises of different muscles, different joints, and the likes. So, is about how you'll be able to move, that there won't be any pain, that there won't be any form of hindrance. For example, now, somebody with paralysis of the face, because it actually happens that it is possible for somebody's face to be paralyzed. That's one side of the face to be paralyzed. We actually call it facial palsy. So in that aspect, the person is not able to move the muscles just because of the weakness. Maybe there is an affectation to the nerve. It can be as a result of infection or a nerve injury. It can be as a result of trauma. So what the physiotherapy will do is actually to enable the person to be able to move the muscles effectively. So, and somebody with back pain as well, because so many people don't even know that back pain actually has a cause. They think it just happens like that. So, back pain as the person will not be able to move the back. So if I'm going to summarize it in one word, is movement. How you are going to move your body from your head to your toes. So without any pain, without any inability. So that's the simple way of telling people what physiotherapy is about. It's not about how you are going to move your body without any pain, without any inability, without any difficulty. So I think that's just what physiotherapy is
thank
about.
You very much. You mentioned something about back pain. Okay, you're not done.
Definition.
Okay, thank you very much. You mentioned something about back pain earlier on while you were talking about what physiotherapy itself means. I would get into that later. But I wanted you to explain the importance of physiotherapy. Now, you've made example of people who have accidents who might need physiotherapists for varying reasons. But remember that in my introduction, I said something about people not voluntarily visiting a physiotherapist, except the doctor says, oh, you have to see a physiotherapist. Now, what are the importances of physiotherapy for adults or for people generally? Because I know that, or I would want to believe that it doesn't necessarily have to be until the doctor writes a recommendation or say you have to go and see a physiotherapist before a person visits. So what are the importances of physiotherapy?
Okay. First of all, I will start from our day-to-day activities. Okay, and that was what I had to send the pictures I sent, because begin from our day-to-day activities, because as I mentioned earlier, that physiotherapy in one word is actually about movement. So now, the importance of physiotherapy, like I was saying, from our day-to-day activities, from the way we sit, the way we stand, the way we sleep, we need physiotherapy. Let me just put it that way. As time goes on, even as somebody is aging, the body is already saying goodbye.
Right.
So many people are not aware of this. There are some wear and tear that are already happening in the joints, in all the body parts. So, okay, like this picture now, that's the ideal way of handling your phone. So many people are not aware of this. They hold their phone and press their neck down, and by doing that, you are actually mounting weight on the neck.
I think I'm guilty of that one.
So you're actually mounting weight on the neck. So by mounting weight on the neck, the person is predisposed, is prone to a particular condition called cervical spondylosis. So wear and tear will be increasing in the neck. So the person, as a result, will start having neck pain. So it will now get to a point that the person we have to be using a cervical collar. So even years to come, so many people will start coming down with this just because of the advent of phone. We start coming down with cervical spondylosis because so we can see the ideal way and we can see the unideal way of handling your phone. So you hold it up and you make sure your neck is actually aligned, is actually in a vertical position. So that's it. So, and even the way we sit, okay, you can see the way we sit, you can see the spine is actually aligned.
Right.
But what you notice about the other one, the person is not making use of the backrest. That's what the backrest of seats, of chairs are meant for. The backrest of couches, that's what they are meant for. They are meant for our back, not to actually rest our back. So you have to move your waist in and make sure your back is resting on the backrest of the chair. But so many people are not doing that. Even in our couches, in our sitting rooms, some people they think throw pillows are just meant to be for play.
For interior decoration.
Just meant for beauty. Throw pillows are not for beauty. Throw pillows are meant for your back. So many people are aware of this. So the education is actually very important. So that's why so many people come down with back pain. Okay, there was a time I was examining a man. The man had back pain, so came to the clinic. So in the process of examining him, I had to ask him, okay, what do you do? What's your occupation? It was then he told me he was a farmer. So now, being a farmer, the oil that they use, they will have to be bending their back constantly. So as a result of that, wear and tear, there will be increase in the wear and tear that will be happening at the lumbar vertebra. That's the low back. So as a result of that, I discovered that the movement at the lumbar is actually limited. So he was unable to extend his effectively. So I just had to ask, because for somebody of his age, the wear and tear that is meant to happen didn't have to be that much. But as a result of his occupation. But so many people are not aware of this thing. So I think even with his awkward day-to-day posture, he was well educated. Okay, after doing this, this is what you are meant to do, just to reverse the effects or just to prevent the wear and tear that is happening in your back. If he was actually educated and he was actually doing that, such would not have happened. He would not even have been a physiotherapy patient in the first place. So it actually begins with education. Education, the way we take our bath in the bedroom. So many people are not out bending your back. You know, when okay, for somebody that uses shower, okay, like this picture now, the right lifting technique. There's a way we lift. You can see the wrong way of lifting. At the same time, the right way of lifting. So the back has to be aligned. The back has to be aligned even when sweeping. In fact, our back posture culture in this part of the world is actually awkward because of the broom we. That's why even I myself, I don't encourage people using broom. Just because there's no how you want to use a broom that you don't have to bend your back.
I think a lot of people in Nigeria are guilty of these things. But not a lot of people. Right here, I've already committed 2 offenses out of some of the things that you've highlighted this morning as regards putting strain on our back, on our bones and our necks and all of that. Personally, I pressed my phone like this and sitting while you were talking, I had to adjust my sitting position to suit the conversation, especially knowing that okay, this is what is best for me. And now I think that will take me back into the back pain that I mentioned earlier, that I said I was going to talk about. Now a lot of people are suffering back pain, and here in Nigeria, especially in Lagos, not just in Lagos, it also happened in Abuja while I was in Abuja. People settle for Abioye or pain, all in the name of back pain. And I think I was talking to a doctor some time ago who mentioned that what people, the combination of ailments that people call that they call JD does not exist, because there are 10 different ailments put together as one, and they are looking for just one medicine to cure like 10 different things, and they call those 10 different ailments combined as JD or whatever. Now, I want to talk about that back pain. A lot of people are suffering back pain in Nigeria, and usually the first point of call for many people is either paracetamol or go to the Alagbo and get Okpain or Agbojedi, because once they start feeling back pain, oh, my back is hurting, and the next thing is medicine. At home, I know you've mentioned some of the tips that we can, some of the things that we can do to, some of the adjustments we can make to our lifestyle to make sure that we live very well, or that our bones are healthy. But at home, let's say, for example, it has already happened to me. I, for one, I feel back pain in my lower back almost like every day. Now, it has happened already. What can I do to cushion the effect? Maybe without taking medicine or with medicine.
Okay, the what so many people are not actually aware of is, okay, for example, now I can remember managing a patient last week. So the patient had the bones, and after having plastic surgery, so the plastic surgeon did not refer the patient on time. So some radiation had already happened. So the mother of the girl was now asking, is there no drug that this girl can use that um, everything will just be solved? But the example I normally give to them is, for example, if the one leg of your chair is broken, where will you take the chair to? To a carpenter, and the carpenter will have to drive nail inside the wood. Why? Because the problem is actually a kind of what can be seen is, so when something is mechanical, when a problem is mechanical, it has to be addressed mechanically. However, for somebody that is having severe pain, the person can be asked to use analgesic. So the analgesic will only take away the pain, but will not take away the cause. So the cause will still remain. So, and that's what so many people are not aware of. In fact, I will say that pain is even a good thing, because pain is an indication that something is wrong.
Right.
So I see it as a good thing. So it's telling us that there's something wrong with this part of your body. So for somebody that is now having back pain, such person using a paracetamol every now and then is we only reduce the pain for some time, and after the effect of the drug has actually gone down, the pain will come back again. So the cause is what we now need to be addressed. Okay, number one, what activities are this person involving himself in? What are the activities? Okay, maybe as we can see the pictures that were displayed, the sitting technique, right sitting, right even in the kitchen, there is a way. Okay, for example, somebody that spends a lot of time on the system, you will see the person will just press the neck down, the back down, and even arc the back. And it will get to a point when the person has done this for a very long time. What happens? The back will start assuming that position. A long time. That's why you see people, even people that are always inside AC, always sitting down with system, you will see them after some years, they will still come down with back pain. You will see them, is going to bend. We actually call it kyphosis. The back will start becoming kyphotic. So such a person, the person we have to see a physiotherapist. So, but however, the first thing is actually the education. And as regards the Abioye, the truth about it is that there's nothing like Jedi.
Okay.
There's nothing.
I know a lot of people will not agree, but please explain.
Some will say it is hemorrhoid. Hemorrhoid is not Jedi. Some will say they will give all manner of medical symptoms just to exactly a hair pile. They will give all manner of symptoms just to actually validate the myth, because it's a myth. So, however, research has found that it is possible for excess intake of sugar to cause inflammation. Like, research has found that it's possible for excess image of sugar to actually cause inflammation of the joints. So it can happen that there can be an inflammation of the joints as a result of excess intake of sugar, according to research. But what they actually call JD, that is pain, it is this, it is that. Some people, after working themselves out, after assuming awkward sitting posture, awkward lifting posture, we now get home, we now think, oh, this is Jedi that is happening to me, and we now start taking dry gin, and all manner of things. And alcohol has a way of reducing pain, and we think what that thing is doing is actually taking away the jedi. And after years, when they now come for physiotherapy and you now examine them, you will now notice a lot of wear and tear has actually happened in their backs. So
but then,
it's actually
okay, there are a lot of people out there that believe, or do I say they are deluded to think that some of these agbo or these dry gins work for the okpayin and the jedi that they are having. Now, what do we say to such people? Because I'm sure there are people out there watching this now and they're like, it's a lie. I still used the abilities of okpayin yesterday. Immediately, my back got the relief that it needed. So what would you say to such people?
The truth about it is that such a person will get relief. Why? It's just like, even if somebody is having an intense pain as a result of an infection, and you give the person a strong analgesic, the pain will go down for that time. For that time. But the effect of the pain will still remain. So when the effect of the drugs now has already weared out, then the pain comes back again. So then we still go back to go and drink the Abioye. And that's why, if you notice in Lagos, the people that sell Abioye, it is the same customers that come to them. The same set of people come to them every day. Just because the Abioye, we only reduce the pain in the sense that I believe is actually a form of herbal analgesic.
Okay.
Like I said, the analgesic we only reduce the pain, but the cause of the pain still remains. So educating people is actually very important for them to know, so that they will not end up becoming our patients.
So basically, we have to first treat the cause before we now proceed into, even if the pain goes away after taking the medication, you still have to treat the root cause. Now, there are a lot of people out there who feel that they need medications. They just have to rely on medications. At some point, I think I know a person who has become immune, or do I say, I don't know the word, I don't know the medical term for it, but literally paracetamol does not work on him anymore because he has taken too much of it, he has abused it, and all in the name of, oh, I have back pain, I have back pain. After it got to a point when he realized that paracetamol was not working, he moved to ibuprofen, and from there to diclofenac, and anything that would just relieve him of the pain, whereas he's supposed to treat the root cause. Now let's talk about treating the root cause. You've made some examples on what to do, mistakes that we shouldn't make in our lifestyle or as we live as people. But I need you to make more examples so that people can get a more vivid picture of what you're talking about this morning.
Okay. For example, the person that you said is always having back pain. The question is, what does the person do? Like, what's the person's occupation? That's where it begins from. So at times somebody's occupation actually predisposes them to back pain. Okay, I want to give an example of somebody that works in the bank.
Okay.
Somebody that works in the bank does not have an idea of the proper sitting position. There's something we call ergonomics. As we taught in science when we were in primary school, that human beings have an ability to adapt to their environment. But ergonomics is actually the opposite. It's actually adapting the environment to human being.
Okay.
So we are making the environment suit um, the life of human being. So, for example, somebody that works in a bank that does not have the idea of what it means to sit properly, what it means for somebody to assume the proper sitting posture, the person will always with back pain. Why? Because the position of the spine is going to be upward. So when somebody assumes awkward position of the spine for a long time, back pain will actually be the result. So that is, like I said, the first thing is the education. Now the second thing, or for somebody who now has back pain, okay, like I made an example of even bathing in the bathroom. I normally advise people, if you are not using shower, put the bucket on the toilet seat so that you don't have to be bending your back to pour water on your body.
Really? Wow.
Yes.
Okay.
For even women that work in the kitchen, make sure your kitchen is set in a way that you won't need to be bending your back every now and then.
What about standing for like 3 hours? I mean, for example, myself, I cook a lot on weekends. So I'm usually in the kitchen for maybe 4 hours, 5 hours. Does that also have an effect?
Okay. What you need to do is just, okay, I normally advise people, if you are the type that stand a lot, try to be stretching your back. That means that means you are moving your back backward, and I cannot demonstrate it because I'm sitting.
I can understand. Something like this, right?
Okay, like you holding your waist and move your back backward with your neck.
Okay.
So hold it for like 5 seconds, then come back, hold it for like 5 seconds. You don't have to bend your back, just go to the back, assume the normal position back, go to the back, assume the normal position back. Do it maybe like 5 to 10 times, maybe like every 30 minutes, every 1 hour,
Okay.
depending on how long we are going to spend in the kitchen. So, in that aspect, what actually happens? I'm sorry I didn't send picture of the spine. When you extend your back, what actually happens is that you are actually opening up. Oh, I didn't send picture, but look at the spine. I I think I can create. I will try to create. Okay, okay. Oh, God bless you. When we look at the spine, from the neck to the pelvis, one thing that we will notice is that everything actually comprises of joints. From the neck down to the sacral, is actually everything is joint. So one joint over the other, one joint over the other, and that joint is what we call the intervertebral joint. So inside the spine, we have the spinal cord. And the spinal cord is not just standing there. Beside the spine, there are some spaces. So all those spaces beside each spine, one vertebra is over the other one.
Are you there, Mr. Olukoya, Tamilore? Well, I think we lost him, and I do believe that we've learned a lot. He has spoken about positions that we should take to help us maintain a good, healthy lifestyle, and to maybe, to an extent, avoid seeing the physiotherapist until very, very much necessary. People often go through different pains that causes them to end up seeing the doctor or a physiotherapist. Well, that's how far we can go on this segment of Daybreak Africa. We apologize that we could not say goodbye to our guest, but that's due to network failure. But I believe and I strongly know that you have learned one or two things from this episode of Daybreak Africa. Now it's back to the presenters of the show. Do stay with us. We'll be right back.